Good morning, everybody. Hi, it's Cassandra Goldie, and I'm Chief Executive Officer of the Australian Council of Social Service. And I'd like to welcome you to this morning's webinar, which will be launching the findings from the report Australian Experiences of Poverty, Risk, Precarity and Uncertainty in COVID-19. I'm particularly delighted, first of all, to be introducing the Chief Executive Officer of the Metropolitan Local Aboriginal Land Council, Nathan Moran. Thanks, Nathan.
Jury Gamarua, Yarn, Babana, Marada, Gadigal, Mura. On behalf of Metro Local Aboriginal Land Council, it's a great honour and privilege to welcome you all today to the ACOSS event, launch 2022 report. Words that I open in, we forever cherish Gadigal, and we acknowledge and pay our love and respects to her and the Gadigal people from where I gather today. Those words translate as G'day, women, men, youth, comrades, friends. I gather from Gadigal country today. I'd also like to pay my respects and honour to all the respective First Nations, acknowledging we're gathering online. A big shout out to all the Yamajis, the Noongars, the Wongais, from the Nungas to the Yolngu, for us Kuris, Guris, Murris, all the way to the south to the Palawa. Much love and respects to all of Mob, our First Nations, original Aboriginal peoples. For Metro Lark, it's a great honour to represent them and to provide you today a welcome for the launch of the 2022 report. For us, we are the first local Aboriginal Land Council of Australia. We're proud to represent a great honour from representing Gadigal, the place where first contact, ground zero for the colony took place. We are the Aboriginal representative body for all Aboriginal people. We're established under the New South Wales Aboriginal Land Rights Act. But what we represent is a long-standing representation of rights, advocacy, diplomacy, and representation on needs for our mob. We're proud to inherit, from 1903, the first coloured association in the Southern Hemisphere, where our people collaborated with all non-English speaking and coloured people to form what may be the first coloured association on earth, at least the first in the Southern Hemisphere. That was here in Gadigal country on what's known as Surrey Hills. In 1924, we were part of, again on Gadigal country, the launch of the Aboriginal Progressive Association. In 1938, the Day of Mourning, our first national Aboriginal conference for all First Peoples. We honour and respect their 10-point plan. We still carry that legacy and we continue to seek out that 10-point plan to be realised. For our community, we stand and represent our communities, who in turn acknowledge our goals and aspirations. We believe it's good investing in First Nations in our communities. We believe that our culture, Aboriginal self-determination, learning from the past, honouring the past activities of resistance to rights. We need to advocate for Aboriginal people's continuing sovereignty. We acknowledge that all First Nations peoples have a right to determine whether it's up to them as to how they would be represented and or recompensed and or acknowledged. We acknowledge that if this country of Australia can mature like all other colonies on earth, the achievement of these things is not far off. Reminding people that in the 10-point plan in 1938, where we elected our first ever Aboriginal person, Arnie Pearl Gibbs, much love to her mob. She carried that message, a 10-point plan. One of those was a national representative system, the access to housing, employment, the access to being able to practice one's culture, to continue our language, to choose to marry whom we wish to be free. I'm sure that they all align to the current activities that we all are seeking in Australia today. And I pay my honour to ACOSS, to ACOSS, all the state bodies who work together to address our needs socially, as a community, community outcomes, but working together to try and achieve equity and parity between all of us. I honour and respect all the work that ACOSS does, stand with you any day, and on behalf of the Metro Local Aboriginal Land Council, its members, our board, Jury Gamarua, have a good day discussing very dire needs, but may you do this well, continue to do what you do, and one day I'm sure we'll get the ears of government, and I'll throw out the other mob who have got more money than our government, the corporate bodies who have traded our lands to trillions of dollars of private land wealth, to billions, near trillions in resources, minerals, and all those other businesses that have never been approved by our people. We say you will have to be honourable, you will have to be humane, and you'll have to contribute to the costs and the operational needs of our country. The Juri Gamarua are all too deadly.
Oh, Nathan, can I say what a extraordinary, powerful and warm welcome to country from you. I'm so grateful, and on behalf of everybody at ACOSS, all our partners in this work, all the people that are participating today, and every single person who cares about human rights and social justice and self-determination, I just want to communicate to you and your mob how deeply committed we are to doing everything we can to deliver for the First Nations self-determination and justice. We will walk every step of the way where we need to be and play our role over the next 12 months and beyond, because we are not where this country should be. And I want to thank you so much for setting the scene for us today. Australia is indeed one of the wealthiest countries in the world. It's us and Switzerland, the wealthiest. And so it's inexcusable that we are still where we are in terms of the outcomes for far too many people, First Nations communities, and with over 3 million people who are still living in poverty. And that is why we are here today. I want to acknowledge I'm on land of the Wurundjeri people of the Kulin Nation and pay my deep respects to elders past and present, and also a very important acknowledgement of First Nations participants in the webinar today. Thank you all again for joining us this morning to launch this latest report from the ACOSS and UNSW and Partners Poverty and Inequality Partnership. The title of this report is Australian Experiences of Poverty, Risk, Precarity and Uncertainty in COVID-19. I'm really pleased to be joining you all to be helping to launch this report today. This is the first in the reports that particularly focus on ensuring the voices of people directly affected during that experience of the COVID-19 with the lived experience of poverty. This is an important report to complement the ongoing analysis of the partnership about the nature and extent of poverty in Australia. We will hear this morning first from the lead researchers on this report, Kylie Valentine, University Nadu, on their key findings, and we will then have a panel discussion which will explore the lived experience of poverty in Australia during the COVID-19 pandemic, which of course is not over yet, including the impacts of policy changes on people's lives. This research and event is, as I say, from the ACOSS and UNSW Poverty and Inequality Partnership, which is supported on the ACOSS side by NGO partners 54 Reasons, part of the Save the Children Australian group, ARACI, Brotherhood of St Lawrence, CoHealth, Good Shepherd Australia and New Zealand, Food Bank Australia, Jesuit Social Services, Life Without Barriers, Mission Australia, Settlement Services International and the Smith family, as well as our philanthropic partners, Heartline, and last but absolutely not least, one of our first sponsors of this work over 6 years ago, David Morowitz and his Social Justice Fund. These are both sub-funds of the Australian Communities Foundation, and also importantly, John Mitchell, very humble man who continues to provide financial support for many of the important causes in this country, including helping to support this work. So many thank yous, many partners. We are determined to deliver change in this country, and that is why we are all here today. Some housekeeping though first. For you, there will be some opportunities to pose questions to our speakers throughout the event, so please do use the Q&A function at the bottom of the screen to do this. And should you have any tech issues, please flag these in the chat function, and we'll certainly do our very best to provide that support to you. Please also, because I know that you are zooming in from all over the country, please do feel free, importantly, to acknowledge country where you are. and if you, it is right for you to also express your solidarity and your support for the work we have now to deliver on the Voice, Treaty and Truth. At this time, 2022, it is December, and the year of 2023 will be a very, very important one on that front. So I would like now to pass to Eileen Baldry, fabulous long-time supporter of this work, and of the causes at UNSW. Eileen is Deputy Vice-Chancellor, Equity, Diversity and Inclusion, and she is an extraordinary Professor of Criminology at the University of New South Wales, to say a few words. Warm welcome to you, Eileen.
Thank you so much, Cassandra. Thank you so much, Nathan, for that really deeply moving and inspiring and deadly welcome to country. I'm on Gadigal land, and I acknowledge that. I also acknowledge that Voice, Treaty, Truth, the Uluru State from the Heart, is very close to the heart of UNSW, and we have stated our complete support for Uluru Statement from the Heart, and to walk with Aboriginal people, Torres Strait Islander people, First Nations people in this country as we move towards Voice, Treaty, Truth. It's my delight and privilege to say this is such a wonderful partnership. UNSW has been the key partner, the research partner, if I can put it that way, in this work since it was first set up in 2017. This work is built on previous work at UNSW and with ACOSS that came from the SPRC. You'll hear from some of those researchers today. When we were doing poverty and inequality reports. In 2017, this stepped up a significant level to including all the partners that Cassandra has mentioned, as well as broadening out the number of reports and the reports on a whole range of topics related to inequality and poverty. And again, you'll hear some of that today. It's very exciting. In 2022, we renewed our partnership, the ACOSS UNSW partnership on inequality and poverty. And this is the start of the second phase. And this is the launch of the next phase, as Cassandra mentioned. The benefit of working together with ACOSS, UNSW working with ACOSS, is that this is a really positive symbiotic working relationship. UNSW uses the best data that we can source, and with ACOSS puts it into the world so that there is a way of advocating for all of the issues that emerge and are revealed in the data. One of the things that we are very excited about is that we are looking to do even more specialised reports, and for ACOSS to advocate for those in the world, in the halls of Parliament in Canberra and in our states, as well as with the community. This report, of course, as you've heard, and this webinar explores the Australian experiences of poverty, particularly out of COVID, and the results of the support for people who were living in poverty and the results of removing that support. This is the partnership's 19th research report. Absolutely brilliant to have done all this work over those few years. As well as reports, the partnership has a website. Please, I hope we have dropped the website link into the chat, please. So as well as reports, we have a website with interactive charts, absolutely marvelous ways of understanding, being able to mix and match and see the impact of poverty on different groups, different places, geographical, as well as an income calculator. So we have produced these in partnership also with Anti-Poverty Week. I'm currently a national co-chair of Anti-Poverty Week, education resources that are being taught to over 60,000 students around the country. So these partnerships are elevating significantly an understanding of poverty and inequality, an understanding of the impact of poverty and inequality, an understanding of what Australia can and should do politically, in government, as well as in our communities to address this. And as Cassandra said, wealthiest country in the world, and we still have these concerns and this shame. And a key focus on that, drawing on what Nathan referred to, is the shame of First Nations people in Australia being centrally involved. They should be centrally involved in addressing this for their own communities and empowered to do so. So you will hear about some of these things in this launch. So thank you so much. And let's celebrate having this wonderful work, but let's also do something. Let's act on it. Thank you, Cassandra.
Thanks, Eileen. Again, just to acknowledge your really important contribution to all of this work, and to say that the combination of the UNSW and the ACOSS and our members and partners has ensured that every single time one of these important pieces of evidence of the nature and extent of poverty in Australia goes out and is released, we use it every single day in order to influence change, to influence decision makers, to get a better result so that we can end poverty and that people can live in a way that enables them to have agency and to have the sense of freedom that comes from being able to meet essential needs and live in society. I'd like to now introduce Deputy Director of the Social Policy Research Centre, Kylie Valentine, and Research Fellow at the Social Policy Research Centre, Yuvisti Naidu, who will be speaking to the report findings. Thanks so much, Kylie and Yuvisti.
Thanks, Cass. Thanks, everyone. Good morning. I'm speaking on Gadigal, on unceded Gadigal land. Can I add my thanks to Nathan for such an enlivening welcome, and to Eileen and to Cass and to the partnership for the opportunity to work on this report, which we think is a really useful contribution because it does draw on the expertise of people who lived through the same pandemic as the rest of it, but whose voices weren't necessarily heard to the same extent as more privileged people. And that was really the inspiration, and we think the important messages from this research. So I'll speak briefly to where we were coming from before Yuvisti does the interesting stuff. So we had an earlier slide that started by saying something like, gee, COVID was pretty important, do you reckon? And we decided that it's no longer necessary to kind of make the case that COVID was an important kind of event that affected the world in lots of ways. So we'll take that as a given. The inspiration, one of the inspirations for this project was the really rapid and in some ways contradictory interventions that were coming out to not necessarily help or hinder people who are living in extreme disadvantage or poverty, but was likely to have very strong effects on them. Some of them we thought would be quite helpful, and some of them were likely to be extremely risky. So on the one hand, there were interventions to protect against economic harm, and on the other hand, interventions that were likely to cause economic harm because of the necessity to protect public health. So on the one hand, you had the coronavirus supplement, which was an increase to the income that people receiving income support payments got. The suspension of activity testing, such as looking for work, for income support payments, which meant that people didn't have to chase their tail quite so much, applying for jobs that didn't exist. Eviction moratoriums and improved temporary accommodation. We'll hear a little bit about the really quite significant and dramatic increase in support for people who were experiencing particular types of homelessness. And then on the other hand, you had things like business shutdowns, lots of people losing their job, changes to school learning, so lots of kids at home, and stay-at-home orders that restricted people's economic lives, but also importantly their social lives and their kind of connections, as well as the fact that it was a pandemic and everybody was terrified and freaking out. So our aim in this project was to explore the effect of these different responses on the daily lives of people most at risk of disadvantage and poverty, focusing particularly on those kind of interventions that I just mentioned. So income poverty and income support, employment and social support, and housing security, evictions and homelessness. And part of the reason I think that it's important to do this, and one of the things that we did bear in mind very much, was that with something as dramatic and as global as a pandemic, there is a real risk of flattening of experiences, or of discounting the experiences of disadvantaged people as only representing disadvantage. So we didn't want the narrative of, well, we're all working at home now and we're all on Zoom now to go unquestioned, because a lot of people weren't working at home and a lot of people weren't on Zoom. A lot of people who write newspapers and a lot of politicians were doing that, privileged people like me were doing that, but a lot of people were not. So we really didn't want the experience of the privileged to become the experience of everybody. And at the same time, we didn't want people who are receiving income support payments to represent only the face of poverty. They also lead complicated, rich, resourceful, giving, denuded, practical, freaked out lives, and we wanted to make sure that their experience was also recognised, and the particular kind of needs of those groups heard in the kind of construction and reconstruction of what happens next. So for this, we spoke to people who are experiencing poverty, and there was a lot of research. There's been more since of people writing about COVID. So we thought we would harness for the perspectives of people delivering support through research that other people were doing. So we could concentrate on talking to people who were experiencing poverty. And with the partnership steering committee, we prioritised groups who were known from previous ACOSS and UNSW research to be particularly at risk of being affected by the pandemic and by policy responses to the pandemic. So that kind of shopping list of people there. It's all in the report if you want to read about method and what we did and how we did it. I assume that most people will find that less interesting than what we actually found. So I'll hand over to you, Visti, so she can go through that. Thank you, Visti. Unmute yourself, Visti.
Thank you, everyone. Thanks, Kylie. Thank you for having me. And I'd like to first pay homage to the Camaragal people on whose land I live. I'm going to start off a little bit by just telling you and giving you an insight into the flavor of the participants we spoke about. So as you know, we had looked at people who specifically came from groups that were known to be experiencing high levels of disadvantage or at risk of disadvantage, or if their housing situation was housingly affected. It meant that people actually came from a diversity of backgrounds, service use, and receipt of different kinds of interventions. It also meant that actually, because we were asking people to retrospectively speak about their experiences almost 1.5 years to 2 years later, we asked them about from the onset of COVID, from January 2020 until between July and December 21. It meant that their income support, employment status, and housing situation often changed throughout the pandemic. Likewise, as Kylie has already mentioned, they're people like the rest of us. So lots of things happened to them in the course of 1.5 to 2 years. Many people faced unexpected and expected life events that unfolded, and some that they could protect against, and some that caught them off guard. So for example, we have Lily. Lily is a young person who is of CALD background and was intermittently between youth allowance and and job seeker, depending on whether she was studying or not. And during COVID, she lost her job, her mother lost her job, she had to move back home, and her father passed away. And all of this was a compounding effect on her. Apart from the financial stress, there was the emotional grief, and then there was also all the lockdown restrictions that meant that she had to stay in this very tense environment within her family with no chance of escaping. And you'll see as we go along that I reflect more on what Lily spoke about in terms of her well-being. As another example, we have Paul. Paul was actually quite new to the social security system until COVID. He's a middle-aged man, but he lived with his parents in their house. His relationship with his mom was very good. With his father, it wasn't very good. He was an intermittent drug user. And during COVID, his mom passes away. His father has to sell the house. His father sells the house to move into a retirement village. Paul discovers that he has no home and he is suddenly on the streets and he has no capacity to earn an income. In addition to the fact that there were geographic restrictions and just difficulty finding employment. So he was one of the stories actually that was found in the way from the temporary accommodation measures that led to social housing and then led to him being able to find a rehab facility to go to. So we asked people what mattered most in terms of the pandemic. And this is not just in terms of interventions, but just what mattered most for them over the course of those 2 years, and actually even this year. The first thing was housing. It's a basic need and their first consideration. It's also crucial in their capacity to attend to other important aspects. As Jackie says, the most important was to be able to secure housing for me and my daughter. That was one of the things that I was most worried about. As well, the second thing was the coronavirus supplement, which we've talked about extensively already in the public domain. So in terms of for what participants were saying, it was integral to financially coping with the cost of living, especially if work was limited. And it also allowed a space for them to focus on their well-being. So Jackie, for instance, was somebody who was quite new to the social security system as well. While she was in affordable housing, it was through her husband. The onset of COVID brought domestic violence, and the police intervened, which she felt was lucky for her, because through the police intervening, it meant that she was suddenly connected with a whole range of different services. And she said, though, that the coronavirus supplement was keeping her. I could afford the cost of living. I can focus on my emotional well-being. I don't know what I would have done if I was in a struggle since the beginning. She had so much to process emotionally from what the trauma she had gone through. And for others, it was actually about the capacity or incapacity to work, whether by lockdown restrictions that closed some sectors or geographic restrictions and stopped them from seeking work. It compounded their financial and emotional stability, especially when they had little resources to fall back on. So as Henry says, I've been stuck in this house and they're saying, go and get a job. How are you supposed to go and get a job when you can't leave your area? So I will now speak to each of these points in a bit more detail. I'm going to start off with employment, actually. As I said already, the impact of the restrictions meant that for many participants, especially, and most of our participants were in low paid or precarious work, lost work or reduced hours. So they described the future uncertainty of meeting day-to-day expenses and how emotionally stressful they was. They talked about how that their normal strategies and resources that they used of things that that would have worked before didn't work now. For example, one of the participants, whose pseudonym is Lucy, had always used a strategy to ensure that she had different employers as a buffer. But with COVID, all her different employers went. So she had no sources, no varying sources of income. And that's how she had survived all along. And although many were very familiar with using budgeting, had a range of different budgeting strategies, the lack of employment exacerbated these budgeting stresses, and it made making the ends meet even harder, particularly and including when they had health expenses that they attend to, whether those health expenses were long-term health conditions that they had to attend to in terms of paying for medication or seeing their doctors or health professionals, or whether there were new health expenses that came up that had to be dealt with because they were emergencies. A less common experience was for those people who were in some way engaged in the workforce, and for them, if they were able to work from home, they benefited from working from home with the travel, and especially if they had kids at home and they could be there to enable their children to do online learning, and also for those who were classified as essential workers, predominantly care workers, and the stability that that brought. In terms of the coronavirus supplement, I might keep this very short because I think most of us know this already. It had a profound positive impact on emotional well-being. At the height between April and September of last year, it was $275 a week. So it reduced poverty at an economic time that ordinarily would have increased the burden. Participants spoke about how it provided the capacity to experience a life without ongoing debilitating money worries, which was a first for them, for many of them. And it was not seen as a bonus on top of an already adequate income. That's important to point out. Most of them used it for essentials, whether it was food, medical, or personal items, things that they generally struggled with in the past. They allowed them to pay off their debt, or at least limit the risk of debt. So some of them afford paying their utility and energy bills, forward paying their rent to ensure that they had security against it. And for others like Lily, it was about addressing emergencies. I mean, I didn't read the quote there, but Lily mentioned in her quote, she had no idea that dying was so expensive. For some people who were, particularly those who were at the behest of the rental market, they had to move. They had to move when they couldn't afford their rent, and they had to pay moving costs that was not planned for as part of, you know, the whole circle of I lost my job, I can't pay my rent, now I have to move. Now there's a bigger cost to move my possessions. Far less often was the use for the supplement and discretionary spending. So really not a lot in terms of takeaway or food out, or even the capacity to save. A few single mothers mentioned that, especially with teenage kids, that the source of money is always attention for teenagers who want other things. And so sometimes they would use it just to bring down the tension in the house by being able to get pizza, for instance, don't have to worry about where their next meal was. So participants described it in the sense, life is a lot less stressful. It alleviates the pressure, frees you up to be able to think more clearly, and it was a buffer. But, and this is the big buff that we've all talked about already, it's a short-lived reprieve. Reduction of the payments and the ending in March 2021 had a pernicious impact. As Dolly said, the supplement in many respects was like a death of 1,000 cuts. For almost everyone, it was a return to living on low incomes, prioritizing basic needs and maintaining very frugal lifestyle. So people had to go back to shopping at Aldi, looking for specials, going back to the food pantry, going back to counting out every dollar to worry about how they'd be able to pay for the cost of bills or groceries. Importantly, though, the payments did something more, the lack of the payments. It reinforced that the regular payments are not enough to live on. It indicated actually what it was like to live with a bit more money, how it was like, how it was possible to live with a semi-ordinary life when you had the supplement, and the withdrawal of that, how impossible it was to live on the benefits provided. As Jerry says, everyone that's on Centrelink is underpaid. What they give, you can't even survive on. You can't even pay the bills, let alone save or get a place. And emotionally, it meant for them that there was a sense of a closing down of a world that was briefly open to them. So people on low incomes experience different as well as shared experience with newly unemployed people. So in this context, the usual characteristics of welfare recipients as morally deficient and lazy were less visible. It was part of a shared experience that was beyond an individual's experience. But the reduction on the stopping of the supplement was a retraction of the shared experience for them. In terms of income support and employment services, it's important to say that actually the same interactions that existed before COVID continue to exist. So actually the main thing that stands out was how little discernible difference there was in the interactions with Centrelink and employment service providers overall. And I'll talk more particularly about the mutual obligations in a minute. But the specific COVID challenges included the closure of Centrelink offices. So, you know, people had talked about before about how one of the problems with Centrelink wasn't actually when they interact with them, it's just trying to get a hold of them. Phone calls were long. They often had to be on long waiting time, like hours on end. And now that they weren't even able to go into the offices, they couldn't actually get physical on-site administrative assistance. And for those people, particularly older people who didn't have access to a computer or weren't as easy with using a computer, the lack of closures of the offices meant that they didn't have the computer access. So all of the MyGov uploading and checking was not possible for them. I think there was a general recognition that there was increased pressure on Centrelink staff in the system, particularly because the communication kept changing. And the communication was so fast in changing that even the Centrelink staff couldn't keep up with it. So as Nancy said, like in the beginning during COVID last year, it was a lot easier, the application process and everything, but now it's just ridiculous. Like they make it so hard so that people just give up. Having said that, though, there was a recognition that Centrelink was trying its best and that they were burdened and that they were doing their best under trying times. So I wouldn't say people didn't have a generosity of spirit in recognizing that Centrelink was trying to do what they could, but it was still very difficult for them as the recipients of it. In terms of the employment service providers, what's important to say is that while the halting of the mutual obligations eased income support conditions and was generally very well received, because most people's relationship with employment service providers was really a mechanism to check that they completed their mutual obligations, it meant that now they actually had no relationship with service job providers, and it meant there was no support to actively look for jobs. So in some ways they didn't have any support to go and look for jobs. There was no way for them to even increase their income if they wanted to. And all of them did. So all of them were still trying in different ways, whether it was to get onto Airtasker, whether it was to go and advertise for jobs cash in hand to try to get other sources of income. As Lily said, I'm doing it on my own. The employment services, all their obligations have paused, so they are not really helping. And then I'm going to talk about housing provision, which Hal might speak about more actually in the panel. So the main thing to say here is that the temporary accommodation changes were very important, and in a way it can be seen as a success story in the way that they were implemented. Active policy to house rough sleepers was instrumental in being found and helped in ways that had not happened before. For many, they finally felt visible, particularly those who are homeless or, you know, in parks or in under bridges or in train stations. And in terms of the temporary accommodation places, the relaxation of rental diaries and longer stays was a relief. And this is against a background where staying in a temporary accommodation is actually very, very difficult. They're asked generally to leave after 3 days to show that to show physical evidence that they've applied for positions and then to reapply. That meant that every 3 days they have to up their possessions, move out, show evidence and move back in. So as a consequence, when these temporary accommodation changes came about, there were mixed responses in how they thought. It wasn't that everybody who was in temporary accommodation thought, right, we've been saved now. Their previous experience had sort of limited their capacity to think maybe there's going to be a change now. So they really could not, it was hard for them to understand that actually this might work. And so they were genuinely very pleased when they were housed in quite nice places. And for those of the ones we spoke to that then transitioned to social housing, it was almost as if through the temporary accommodation provisions, they were able to finally secure stable housing. However, it's important to say that that was not a universal experience. So those people who were new to temporary accommodation still had the same relentless problems. As Nancy says, that even though the government policy had changed, the housing provider or the service provider, the temporary accommodation provider that she was with said that nothing had changed and that they still had to put rental diaries and move out and reapply. So the transition to social housing for people with complex needs, I think would be fair to say was a partial success story, especially when the service provision was individually focused. As Henry says, just the way she approached me, and I got to have a chat with her and tell her a bit of my life story. And then I sort of trusted her, and then she got me into a place. So in terms of well-being, right? COVID did dramatic things to all of us, it'd be fair to say. It put us in a very precarious situation in terms of how we dealt with social isolation, changing rules, things that were beyond our control. So the same uncertainties, griefs, and fears that experienced by more privileged people were the same for disadvantaged people. And this included concern for family and care and homeschooling. Betty talks about how it was challenging because her mother was in an aged care home, so she was not able to visit her, plus the fact that she had to homeschool her daughter, and her daughter wasn't independent in her studies, and it was hard for her to be emotionally available to both these people on either side, to be in the sandwich generation and have to cope with it. For some, and I have to say a few, benefited from time with more loved ones or more time to rest. But actually that was mostly for those people who had secure housing and who could either had some engagement with the labor force and also still received job seeker. For the majority, though, the low income excluded access to many of the same compensatory strategies that the rest of us use. So whether they streamed or online socializing, shopping, or hobbies, they all cost money and people in low income couldn't afford it. It also heightened damaging experiences or exacerbated those experiences that already many of them were already feeling. So social isolation, increased worries, and the health tolls on their mental and physical health. So Betty talks about how she would have these little breakdowns, a little bit of stresses, not a lot, but just constant, like a constant source of chronic anxiety. Eric talked about how when he stepped outside, he almost didn't know how to relate. And quite a few people, when we asked them about what their hopes of and plans are for the future, couldn't conceive of it. Lily says, I can't think long term anymore. I think that's a harder struggle currently. I found that very sad actually for Lily, because she was a young person, and to hear her talking about how she can't think beyond 6 months, the future was so unpredictable, where she would be, how she would earn income, what would happen, was hard to hear, and feeling let down by the government is what she talked about as well. So what worked in terms of their factors to get through? The first is to say that that was their capacity to draw on their own knowledges and resources. Participants use their own agency in deploying life strategies to survive, often based on their long histories of housing and income insecurities. This meant that they were aware of how the system worked, their awareness of their rights, and they were able to persist when contesting requirements. For those who were able to who had relationships with other people, whether they were friends or even support workers or family, it reinforced to them how important these relationships were. Things that some of us may take for granted, where it was quite apparent that this existed for some of the participants, but for others it didn't. They had no one, and the lockdown restrictions meant that they were very socially isolated. So those who were able to reach out were able to survive in better ways. And their own awareness of their courage and ability to learn. They understanding that they were survivors, that this was another adverse event amongst many other events, and that they would survive it as they had survived all the other things, and that they would persist despite the stigma of living in poverty. And on my part, I'd like to end by saying that actually what stood out was the role of a single person as a critical conduit between housing, income, health, and social supports. Participants, importantly, didn't talk they talked about the outcomes, the actual physical, tangible outcomes of getting a house or being able to get the payments or being linked in with mental health professionals. But what they also talked about was the importance of being listened to, treated with respect and care, encouraged, valued, and provided with assistance, and how important this was as enabling of a sense of possibility and well-being for them. Just being able to speak to someone, being able to be heard, and then to have a plan of how that could be resolved. And often this was a support worker, but it's important to say that this also included friends or other service providers. So for some participants, it was their doctor who helped them, who went above and beyond the general GP consultation and said, I'm going to put this letter in for you, and I'm going to help you with this. Yeah, I think I'm going to end there. It's handed off to Kylie now.
Thanks, Vissi. And I am mindful of time, and we do have a great panel who I'm very keen to hear from, and I'm sure that everybody else is too. So I'll skate through the last couple of slides. On the service provider perspective, say two things. One is that they mostly reinforce what we were hearing from the the people that we were speaking to. But also, as I said at the beginning, we were focused on a particular group of people, those who we thought were most likely to be affected by public health orders and by some of the changes to social security. So some groups were excluded from our research because of that, and also were living in really heightened risk of poverty and other disadvantages. So most notably, people whose visa situation meant that they weren't eligible for any kind of income support at all. And so there were a range of groups who face either new risks or heightened risks because of the pandemic, including international students, temporary visa holders, people from refugee backgrounds, young people, and domestic and family violence was obviously a big concern for a lot of people, including service providers. We weren't focused particularly in this project on that. And the final slide we have is on policy implications. And I think that they've been kind of fairly clear from what we've talked about so far. The thing that I will end on, and the thing that maybe hasn't been emphasized so much, is that while the provision of resources, mostly money, was really, really important, also important was the fact that it was rolled out quickly, with little paperwork, little conditionality. It was easy, it was quick. People have made the point that that was partly because so many people were now affected by it. So things that you can kind of get away with if you're only supporting a stigmatized and devalued group, you can't get away with if it's a population level effect. So there, part of it was that, but part of it was just that it had to be so quick, and it was done on the fly. But that absence of conditionality and those kind of low threshold criteria really, really make a huge difference. When people spend so many of their resources and time just going through the basic requirements to get the entitlements that they need, it really depletes their time for other things. And so being able to just get it without spending your whole life proving why you deserve it also made a huge difference. So that's a bit of a complicated point to finish on, but I will finish there because I am keen to let other people have a say. And thank you all.
Look, thank you so much, Kylie and Uvesti, for the presentation. And may I say, Kylie, that last point is a very important one. So it's a great place for us to move now into the panel discussion. So facilitating the panel, very warm welcome to colleague Professor Carla Treloar, Director of the Centre of Social Research and Health and the Social Policy Research Centre, and the co-director of this partnership with ACOSS. Great to see you, Carla. Carla is joined by Hal Pawson, who's Professor of Housing Research Policy and Associate Director at the Centre City Futures Research Centre in UNSW, Nadine Carahar, a Community Rehabilitation Support Worker with NEMI National in New South Wales, and really warm welcome to Ashley Stevenson, extraordinary advocate with a lot of direct experience of some of the issues that we're going to be discussed today. And Ashley has been a really important part of the Raise the Rate campaign as well. So really great to have you all. Thanks, Carla.
Thanks, Cass. And again, thanks to Kylie and Uvesti for such an awesome piece of work and lots to unpack and get through. And I think part of the reason to have this panel discussion goes to one of Kylie's early points of not wanting to flatten out experiences, but to really delve into the complexity of people's lives over that period and now and into the future. So we're going to direct a couple of questions to each of the panel members, but obviously happy for other people to add and contribute. And there's a couple of questions starting to pop up in the Q&A. So just while we're getting ready to go through that, Uvesti, can you let people know if the slides will be available for circulation? Let's see.
Yes, I think so. If they want it, they can have the slides and the report for sure.
And the report. So I think we might ask Penny to pop the link to the report into the chat if it's not already there as a start. and then we can think about the slides later on. So Ashley, we wanted to start with you, and you know, in the report and the data that Kylie and Uvisti just presented, people have obviously drawn on a lot of skills and supports to make it through these very challenging times. And this was a roller coaster period over 2020, 2021, with people having to find new ways to cope. So what's the personal cost of living with those changing circumstances, uncertainties? How does that affect people?
Well, for me, it's over the last decade of unemployment and homelessness, an increasing level of anxiety to the point where I thought I might start suicidal ideation. Yeah. Terrible, like just the tension, you know, and then every now and again it'd get worse. The COVID supplement was a relief, but then after that was withdrawn, the anxiety ramped up far above where it had been before.
That's a very profound description, Ashley, and we thank you for keeping active in advocacy and telling these stories so we can really humanize those experiences and understand what it's like to live them on the ground every day. So thank you very much. Did any of the panelists want to jump in on that question and take it a bit further? No,
Would you like me to tell you a little bit more of what's happened over the last 10 years? Well,
please,
I last had a full-time proper job in 2013. I'm running out of battery now because I've got no internet inside the house.
Oh no.
Hang on, I might be able to go to my phone.
Okay, well, while you're doing that, Ashley, and thanks for seeing what you can do to sort that out. Nadine, what did your service observe over this period in terms of how people coped, and what's happened since?
So our service was set up directly as like a rapid response for COVID. I found how people coped was, from my experience with the housing offices that we worked with, there was quite a good relationship there. People were more willing to engage with housing because they were a lot more lenient on temporary accommodation. There was no, like, there wasn't that added pressure than what it was previous, because they got to be extended quite a lot. And they had that no pressure of like looking for private rentals. And then also because of the borders being closed and overseas people having to go back, and we found there was an awful lot more private rentals available, which did give people an awful lot of hope. So that was a good way to cope for them. And then also I found there were a lot more willing, like we were working a lot with rough sleepers, long-term rough sleepers, and I find there were a lot more willing to engage with services such as mental health, drugs and alcohol, and particularly parole as well. Like they were quite good at keeping in with everyone because they knew they needed the support. So they were like the main things that we found was a good coping mechanism for our consumers. In terms of change now, it has gone back to like the strict temporary accommodation rules, which is putting that added pressure back on people. And yeah, some of them mightn't be as willing to engage with services as much as what they were in the COVID lockdown.
We'll come back to Ashley in a moment. I can see that you've changed your or did you want to, you've got your hand up there, Ashley. Did you want to jump in?
Yeah, sure. Well, I last worked in 2013, and so applying for hundreds of jobs over the last decade and only getting 3 replies that went.
Oh, we've just lost your sound, Ashley. Did you bump the mute button or something?
She's got a connecting to audio thing up, so I think it's a connection coming in and out.
All right, Ashley, we can't hear you at the moment. Maybe she can't hear us either. So Hal, I wanted to bring you into the conversation about, we saw these changes in housing policy as Nadine's outlined. Were there some groups that were better served by others than in those policy measures? And what were the good and bad things about prioritising different groups of people living with disadvantage?
Yeah, thanks, Carla. I mean, I think the two biggest initiatives that were specifically about housing were the emergency accommodation program or programs that Uvesti already mentioned. These were big, although they didn't occur in every city. They were, or in all parts of Australia, they were mostly concentrated in Sydney, Melbourne, and Brisbane. Also, to some extent, Adelaide. And in those cities for several months of 2020, there were tens of thousands of people being put up in hotels, or in some cases student housing, and good quality hotels as well. I mean, as some of Uvesti's comments, or the comments that come through from the research have shown, people who'd been homeless before and who'd experienced temporary accommodation before had experienced the tough conditions that are attached to that, and also quite often pretty poor quality accommodation that they were being given as well. And so this was quite a remarkably better experience for people who'd had that experience before. Who was helped more than others? Well, I think that one of the second important housing intervention, which isn't really reflected so much in the report because of the way that I think the interview recruitment was targeted, it was the rental eviction moratoriums. And those occurred in every state and territory, and continued in some shape or form for most of 2020, and in some cases through 2021 as well. And they protected, well, it's not quite so easy to count how many people, but we definitely can see the effect of rental eviction moratoriums, because the homelessness numbers, people becoming homeless because of the loss of, or because of an eviction, those numbers actually fell away quite significantly in 2021, and I think we've still got some feed through from that even now. So that also was another a very unusual and quite significant intervention. And what both of these interventions shared is that they didn't discriminate against people who don't have full citizenship rights. Unlike the coronavirus supplement, which wasn't available to international students or non-permanent residents, other non-permanent residents, and that I think was that was a very important aspect, that both of these things, they were not conditional on having that status, but unfortunately there was a downside to that, because at the end of emergency accommodation programs, when some people were being helped into longer term housing, you didn't qualify for that if you were a non-permanent resident, particularly New Zealand citizens. That was quite a significant group, I think, who have always been there in the homelessness population probably, but I think became much more obvious, have become more prominent since, over the last couple of years, partly as a result of the fact that, yes, they were helped in the emergency period, but once that came to an end, they were really conspicuously not helped.
Mm. So I just want to flag with Giselle and Ricky and Jessica in the comments, and Bruce, we'll come to you. We're not ignoring you there in the Q&A. It's coming. Nadine, is there anything you want to pick up from Hal's comments there? You're on mute.
Yeah, I do agree with that, particularly like it has been touched on a few times, the temporary accommodation. Now that they've gone back to like the stricter policies, I think people are struggling with that greatly at the minute. And then as well, as I said, like with overseas people going home, there was more rentals. Now that borders have opened back up, there is very little private rentals available. And then to the increase in living as well, when most of the consumers we are helping are on job seekers or disability support pension, it's an awful struggle now at the minute.
Yeah, so things remain very difficult for some people, obviously, as we go through. Kylie and Uvisti, is there anything on the housing issues that you'd like to add from the data that you didn't get a chance to touch on in your presentation? No, it's all in the report. Go and have a look. It's fantastic. Jazika in the chat, yes, acknowledging the privilege of having stable internet connections. I'm working in a new place today. I didn't know if I'd have stable internet, so it's a kind of a necessary tool in our modern lives. So thank you for pointing that out. And I think Ashley's still having a bit of trouble connecting back to us. So Kylie and Uvisti, then, was there anything that surprised you in the data that you collected? Were there things that you hadn't heard before, I guess, or weren't expecting?
I always get surprised doing research. That's one of the very nice things about doing this job. I think that one of the things that wasn't necessarily completely unexpected, but was really good to be reminded of, was that for many people who had been living on job seeker for a long time, you can't live on it. I mean, this is something that is rehearsed often, but yet people still do it. And for a number of people, the strategies that they had used, Uvisti did mention this, but I do think it's worth underlining, the strategies that they had used to negotiate the thresholds and the rules and the kind of constant negotiation of income that went up and down, and little bits of work here and there, were the things that helped them survive, because you can't survive on unemployment benefits. And they often fell away as well. So the strategies and tactics that people had used because they'd had to, and they'd done it really, really well, were taken away during the pandemic. And that was that was a kind of extra blow. And also worth being reminded was the kind of care and resources that people used and kept using during the pandemic to look after each other, including, things like veggie growing and swapping, and, looking after people in the neighbourhood in exchange for food being grown in veggie gardens, those sorts of things. So people who were receiving support from their neighbours were also giving support for their neighbours. And in the course of this time, when people were so terrified, I think it's really worth reminding ourselves how scary this was. They continued to care for each other, and one of the really debilitating things about being sort of made to stay at home was that kind of loss of being cared and having the opportunity to care for others. So, as I said, if it was surprising, I shouldn't have been surprised by that, but it does come through very, very strongly. Yeah.
Thanks, Kylie. And Ashley, you're back with us. Hopefully you got some battery there now.
Yeah, I'll run an extension cord. There's no mobile reception here, and the house Wi-Fi is not very good. So the 7 years that I went.
Sorry, Ashley, on the positive side, we can hear your lovely bird life in the background, which is lovely.
Yeah, it's not bad. They sing. So the 7 years I was out of work before COVID hit probably helped me, that I wasn't surprised, that things were getting a little bit worse, but in some ways a bit better. The job police were off my back. Centrelink was off my back. Because I've always wanted to work. I've worked since I was at school, and this was the first time in my life I hadn't been, my applications were just ignored, and that I was never made for a life of staying home. I'm not married. I don't have children, so getting up and going out to work every morning was just my thing, and suddenly that was all gone. COVID, after the supplement was gone, was very difficult, and I was couch surfing while the supplement was there. And I thought maybe afterwards I'd be able to get somewhere to live, but no, the last 6 months I was renting, but I was also working for no money for the landlord, 17 hours a week, and I couldn't do the physical heavy labour anymore. And so she didn't renew my lease, and I'm couch surfing again. Oh, I went through emergency housing too at the beginning of COVID lockdown, and it's a very cruel system. At a time when you weren't being able to do inspections of properties, the DCJ was demanding that we do inspections before we applied. So you couldn't fill out your rental diary, and they locked me out in the street. Yeah.
Ashley, thank you for sharing that.
Welcome.
And, you know, I think it's so important to put a face to these experiences as well, and have that presence of these are real people here, part of our society, that we're failing in the ways our systems and policies are running. Giselle in the chat has highlighted people on, if I'm reading this correctly, oh, sorry, Yviste, did you want to jump in?
Actually, sorry, I wrote some notes. There's quite a lot of things in the report that we couldn't get to present today because of time limits, and sorry if I did go over time. Couldn't see the clock there or the chat not presenting, but like Kylie said, I find listening to their stories always surprising. There's so much, and there's so much depth of what people have to go through. But some of the things that really struck me was how much the role of luck and happenstance plays in the choices people have, and then the end result of what they have, or whether the outcomes are positive or not. And I'm thinking particularly of one person who had been with a particular Centrelink office for years and had received no help, and she had to change location, and in doing that happened to find another Centrelink staff who just had a whole different perspective, and were able to completely through that, you know, she enrolled in TAFE, she volunteered because that's what they said for her to volunteer. She got a stable job. But she said if she hadn't moved offices without even knowing or planning to do that. And so the role of the luck in how things happen to people really caught me by surprise, because it's not as if people deliberately choose to be in these situations, and things are constantly, there's like a compounding of obstacles, and before they can deal with one thing, they have to deal with the next. So if they don't have housing, how can they possibly deal with getting a job? And so what stood out for lots of people, particularly in temporary accommodation measures, was how they happened to be at the right place at the right time for the local worker to have found them. And in being found in a way, they were able to then transition to social housing, and how by that day they happened to be there and they were found, it meant that they suddenly were connected to a whole range of other support services. So of course the question is what happens to all those other people who aren't in the right place at the right time, or don't move, or don't happen? It's all the invisible parts. And this thing, the stories that came out where my situation was fortunate because happened, or my situation was unfortunate because happened, of no responsibility of the individual in a way. The second thing I wanted to talk about was that the services, when they were given enough resources, had the capacity to make instrumental change, and COVID showed that they have the pickup to be able to move quickly and respond quickly. And they showed a lot of tenacity in doing that. So I think that probably needs more broadcasting.
And I think that reflects the comments Giselle's making about where's the gateway for people who don't have support to find those services, and whether it's luck, but then it speaks to a system that's not finding the people that need support and services and access to things that could be provided for that. So I think that participant, Jackie, that Giselle is referring to, and then what you were speaking to, Yviste, shows us where our systems are still wholly, like full of holes. And this part of this report is identifying those gaps in services that need to be rectified to ensure that people aren't missing out. Bruce Bradbury from SPRC has jumped into the chat to give some more context about the motivations for introduction of the coronavirus supplement, and in a great cross-promotion effort there has referred people back to the Poverty and Inequality website to go and have a look at some COVID maps, and particularly pointing out the former Prime Minister's middle-class electorate and the impact of job losses in that electorate. So there's also a comment here from Ricky about the costs of deteriorating mental and physical health and the increasing supports required for mental health issues in our community. So really interesting question, Ricky, about the comparative costs of kind of treating the symptoms of increasing mental health distress versus understanding what could be done up front to avoid those kind of costs. Does anybody want to comment on that? And we seem to have lost Hal out of our panelist lists anyway, but we might be.
Yeah, Hal had to leave. He put it in the.
Oh, sorry, I missed that. Thank you, Kylie. Did you want to talk about mental health costs? Prevention's worth more than cure, if that's the old saying.
Carla, I think I'm not sure if I can abuse your position as facilitator to do this, but I think you actually know quite a bit about this, so maybe you could say a little from your research.
Yes, definitely. You know, I work in research with people living in various ways, various aspects and experiences of marginalisation, and adding stresses to people who are already struggling in terms of fitting in with, keeping up with, having a role in society is really tough. And my particular work is around stigma and the costs of that. So we know that people who experience stigma because of their personal situations are less likely to go to services because they're fearful of how they might be treated when they turn up because of people's assumptions about them. And that can then, you know, exacerbate all sorts of health, including mental health issues. So it's I really appreciate Ricky raising this. Is, you know, one of the concerns. We've also published as part of the Poverty and Inequality Partnership, and I'll refer back to the website now, an analysis of health conditions by social gradient, various aspects of income measures. And of course, we see what we would expect, that people living in less secure and with less income and those material conditions report worse mental health as well as worse physical health on a number of measures. So it's no surprise there. I think it's, Ricky, you're pointing to, well, we can't just keep on with this. It's costing us for these individuals and their families, and it's costing us as a society to kind of put band-aids on things after the horse is bolted. Completely mixing my metaphors there, but hopefully that is a clear comment of where to go. So Penny, maybe if you can find that particular report and pop it into the chat as well, that would be great. And Ricky's also asking, how will the lived experience statutory body be formed, consult and report? What are the guidelines for setup and operations, and will those be made public?
I assume this is the new body that's called the IR inclusion thing that David Pocock passed this week in the Senate. I'm not sure that it is a lived experience body, and I think that there is quite a little bit of skepticism from experts about what this group will actually do, if it is a group to make decisions or if it is a group to conduct more reviews. I know that Cass will know a lot about this, and she's just made herself visible, so I will mute myself with gratitude.
Look, it's okay. I'm happy to comment at this point. Carla, just checking whether you can hear me. And
yes, all good. Go ahead.
Okay, great. Look, and I think, Carly, it's important to have healthy skepticism, and therefore to bring expectations. So Ricky, the details of this announced Economic Inclusion Advisory Committee are still being developed. ACOSS has for a long time advocated both for an urgent increase to income supports to ensure that everybody can cover the basics, and also to establish a statutory body that ongoing provides arm's length public transparent advice about the need to sustain the adequacy of income supports for a range of different people, so that we never end up in the situation where we are in right now again. So we have welcomed the announcement to legislate this, with the Prime Minister agreeing to it, the Treasurer, the Minister for Social Services, and obviously it was an important piece of an ask from Senator Pocock, who was a very strong advocate for increasing job seeker. We are recommending that obviously the body is fully open and transparent. We'd like to see a selection process for it, but it may be that it ends up being by appointment. And we have from the beginning said it's really vital that the expertise of people who have lived the reality of being on Social Security, your kind of experience, Ashley, and others, including possibly in this chat right now, is brought onto that body. So that's a part of the design that we have advocated for and will continue to do so. So Carly, I think everybody should have their view about this. Feel free, go for it, because it has been far too long where it's been, successive governments have looked to Social Security and social services as a place to cut and make savings rather than actually giving this the highest priority in terms of budget decisions. And so we'll work every day to try and get that as the outcome. Thanks, Carla.
Right, really important interjection there, not an interjection, addition to this great conversation. Thank you, Cass. And I'm also noticing in the chat that people are sharing aspects of their experiences. Thank you, everyone. This is part of the work of this partnership, is to connect this research with real experience and to translate that into advocacy and change. So each time we hear experiences, it gives us more fuel for the fire to keep talking and raising these issues with people who can make changes. And also just point to Ashley's comment about mental health care. The only affordable mental health care is right at the crisis end of things, and little or none for preventive services for people who aren't able to pay for other private things. So we're getting towards the end of the chat time. So I wanted to ask our panelists what's next, to help us inform our research agenda for the coming years, as Eileen mentioned, of this partnership. What's next? What do we need to do? What are the stones left unturned for us to be looking at? Ashley, did you want to jump in? You're on mute, Ashley. Still on mute.
I'm just really grateful that there's people out there that do care, and I'm hoping that government policy in regards to the poor will change, and we don't go back to the bad old days of the last decade. I hope that I can help younger people coming on. It's all too late for me. I'm getting on for 70 now, and I don't know where I'll end up. I can't see me ever getting a home.
Actually, it's
my friends have just about had it with me.
It's very sobering to hear your story, and I think you've given us an amazing contribution today that lifts this research into real life. So we thank you for that.
Yeah, anytime.
Nadine, is there, just checking you're still around, is there things that you would like to see on the research agenda for this partnership to pursue?
I just think the fact that there's been research done, it's just increasing awareness of the bigger issue, and that it doesn't seem to be really going anywhere. So I just think like the fact that the research is being done is really like positive. And in terms of like what you could do, I don't know, like I just think what you have done at the minute with the report has just been really good.
Well, Colin, Yuvisti, you take that compliment. Sorry, I've got a bit of background noise out here now. Kylie and Yuvisti, what else what does your research point to as gaps for the future?
So I think we've talked about it a little bit today, which is that with the best will in the world, and with a really specific intention to hear the voices of people who aren't generally heard, there were still a lot of people who remain invisible, those people who aren't entitled to anything, or those people who are excluded from any kind of services or support whatsoever. And the numbers may not be very big, and no shade on the ACOSS UNSW numbers producing machine, because those numbers are very powerful. But if a population is invisible and they can't be counted, sometimes it is difficult to make those voices heard. And those people who are excluded from attempts to stop exclusion, I think remain a priority. The other kind of bit to this was, and we talk about it in the report, but we haven't talked about it so much today, is that sort of brief moment when we recognize that poverty, unemployment, precarity, not knowing if you're going to be able to have toilet paper or fresh veggies, is a societal concern and responsibility. And it was only when it affected a whole bunch more people that it got taken seriously as that, rather than there must be something wrong with those people. So if we could retain that kind of sense of the sort of dropping of the dividing of people into people like us and people who don't deserve the things that we do, or people who bad things have happened to because there is something wrong with them, I think that would be something that would be worth preserving from those horrible, frightening times, because a shared sense of solidarity and a shared sense of social responsibility is what's going to make a difference, as well as all of those kinds of other resources that we've been talking about.
Thanks, Kylie. Yuvisti, what do you reckon?
I think they've probably all covered it up, but I'm just going to reiterate that apart from the obvious, which is increase the benefit, provide more social housing, stop mutual obligations, which don't work, and actually change the profile of job providers so that they're not just a mechanism to check off mutual obligations, but actually become a service provision that actually is enabling of jobs, with the recognition that in a national economy, you need to create jobs for people to get jobs as well. I think it's almost like a wheel. You know, they have to struggle so much to get so little, and yet they're being penalized for struggling when it's not within their capacity, or there aren't positions for them to get. So I think those are things that are already been well spoken about, but I would say that they should be reinforced. And I want to reiterate what Kylie says, the shared experience was very important. This idea that of inclusion, that we are not a group that needs to be marginalized or stigmatized, that we are also trying very hard, and that this gave us a chance to see what it was like to be considered normal and then to go back. I think there's many emotional damaging consequences of the inclusion should be had, but the inclusion and then the sudden exclusion almost makes the very inclusion worse in the first place. And that should never have happened. So I'm not saying that they should be excluded at all. I'm saying that they need to be included permanently, and they should never have to feel marginalized, because the mental health consequences are far-reaching.
So thank you. And just like any good discussion, it's all hotting up in the chat, and you know, we could go all day on pulling apart the issues. Thank you to everyone who shared in the chat and in the Q&A. And I note Stacey from ACOSS is again giving a bit more info about the new panel, and inviting people to reach out to Stacey if you want more information. So I'm going to hand back to Cass now to do a thank you and wrap up. Over to you, Cassandra. Just checking that Cass is still connected.
I'm definitely still connected.
Right.
Thanks, Carla. So just want to, first of all, of course, thank everybody for joining us today for this incredibly important and, again, very timely discussion. I'd first of all like to thank Nathan Moran for his welcome to country. Very open-hearted and big-hearted thanks from all at ACOSS, our members, and everybody who cares about social justice and equity and inclusion. Thank our speakers, Ashley, Nadine, Hal, Uvisti, Kylie, and of course you, Carla. I'd also like to thank everyone from the ACOSS and UNSW teams. For ACOSS, I particularly like to again thank Penny Dorsch, who leads this work together with Jacqueline Phillips, and also Danny Prevatira and Olivia Greenwell, who were also very important in making this event happen. It's not only about making the event happen, of course, it's about it being another moment where we all recommit to take action and to do what we need to do to change this reality. There's many things to take away from this research, I think. One of the things you can hear very powerfully is the notion that actually what was demonstrated during that period, how straightforward some of the systemic solutions are to ending poverty and delivering on people's need for stable, affordable housing. These are really basic things. And as one of the wealthiest countries in the world, we absolutely could deliver it. And so people are right to feel angry, to feel distressed, to feel deeply concerned and frustrated that is still not where we are. But also, you know, when, for example, thank you, Ashley, when you, you know, share, what it also does, and you can see it happening in the chat, is it highlights what a shared experience this actually is. COVID was one of those times where unemployment hit a whole bundle of people at one time. And so there was a visibility to it. But the reality is, as I've said in many meetings, even in the last week in Canberra, what is happening right now around the country is another group of people are today losing their jobs and will potentially, as you say, Kylie, disappear from sight unless we change the democratic processes. Of course, the advocacy on the voice is a part of that for First Nations. This Economic Inclusion Advisory Committee is another opportunity to ensure that the experience of being without enough and being so socially excluded as a result is front and centre every single time that those that have the power to change this picture make their decision in an independent and transparent way. We want to see income supports lifted urgently. We're very aware of how crushing the costs are for people right now. And for most importantly, that's the reality for people on very low incomes. We're very aware of the need to also make sure that the visibility for people on temporary visas, people who don't even have rights to social security, are some of the most acute when it comes to exclusion and destitution. And so it's so important that in this stage of the partnership, a very warm welcome to Settlement Services International, also Food Bank. Food Bank is out there on the ground providing food, but is one of the first to say we need adequate income support so that people can routinely be in the shops like everybody else purchasing food. We've got our other new members include Aracy, and also I'm just having a tech problem here myself, Ashley, thank you. Just to make sure I don't miss Life Without Barriers, Jesuit Social Services, and 54 Reasons as new partners into this research, as well as Co-Health, Mission Australia, Red Cross, Brotherhood of St. Lawrence and the Smith family, and David Morowitz, who are very committed to this work. I want to assure everybody who has always having this experience that the partners in this research are not about generating reports, we are about delivering change. So please get involved. Join the Raise the Rate campaign if you're not already a member. That's about incomes. That's about income support. Join the Everybody's Home campaign, which is about affordable, safe, secure housing. These are the really basics. Lift up your voice if you can, to continue to talk to friends, to talk to family, to talk to your local politician, because what I can assure you, as somebody who was in Canberra over the last week and a half, it doesn't just happen that certain politicians chose to commit to delivering on this economic inclusion advisory body. We were advocating for the urgent increase in job seeker and the establishment of a statutory body to ensure that once we fix income supports, we never end up here again, because we can afford to make a change, and that's what we're all here to do. Thank you everybody for being a part of this discussion today. Particular thanks to the researchers and to our panelists and to everybody who's been involved in this event. Go well today, go safely, and we will all continue to do what we can to change the picture. Thank you.